Thank you very much for introduction, dear Emil. Distinguished colleagues, dear friends. First of all, I would like to welcome you on this outstanding Congress for Aesthetics and Longevity Medicine, which will be provided today. I would like to express my gratitude for company Global Med Care and company Novacutan to be invited me in this event and to have expert lectures about new product. So, first of all, let me introduce myself. I'm practicing as a medical doctor of science 1985. It's been a long time, almost like half a century. And usually I started as a doctor gynecologist, and as advanced gynecologist, I worked a long time in different countries. And current 20 years, I'm practicing in aesthetic medicine and intimate aesthetics, and also regenerative and longevity medicine. Achieving in these fields special results. And always in my practice, I provide my mission, my medical mission, and this is mission of my life. And mission is to do my patients healthier, younger, and happier. Actually, to do happier is main point of our mission, our activity for each of you, because we are doctors in aesthetic medicine, and to create happy, to make happy patients, it's number one for each experienced doctor as you are. Therefore, the right title of my lecture today will be sound like how to make our patients happy. Definitely, the answer is ready, and the answer is using new generation of product, which are Novacutan BioPro. And now, dear colleagues, I would like to reveal for you all secrets of this product, to show the evident advantages and proven benefits. So, let's start. We will talk about Novacutan. First of all, we should to know about roots. And roots of Novacutan, it's a company which are based in the France, in the Paris, and company called Fiji. This company was established in 2015 in the Paris. Very important day. Laboratories Fiji, France, using innovative approaches in the development of new formulas, as presenting fundamentally new range of injectable products for rejuvenation, protection, and correction of age-associated skin changes. And main product which we can to use in our practice to achieve successful result is at first Matrix active fillers, Novacutan F Bio DVS, based by DVS cross-linked. It's light, medium in volume. And today we will accent our attention for the Matrix Biomodulator, which call it Novacutan BioPro, which is main features of this product. It's very important. It's this new generation of the product provide extracellular, intracellular, and mitochondrial activity. For extracellular, we can to achieve slim face, for the intracellular, we can to improve skin quality, and very important, it's mitochondrial activity. It's proven activity. I talk you a little bit later, for shining and tighten the skin. And actually, only Novacutan BioPro, its first matrix bioregulator with proven activities. Dear colleagues, let me to remind you the history of and evolution of the anti-age product, which started from 15th years last century, when we used mesotherapy on the water-based, and now we come to see, like on the top of product, it's Matrix Biomodulator, Novacutan BioPro. What is special nuance and special features, and how it's provided, how it's created, the special features of this product? This special activity based on the special technological process, which provided like three stages technological process, created 3D microspheres, which micropore structure inside. Then they are connected in each other in microgranules, as you can see, and create 3D designed visual system. This patented formula to enable extracellular regeneration to restore skin elasticity and natural volume. Novacutan BioPro, like Matrix Biomodulator, create new technology and base it and use only high molecular weight hyaluronic acid. It's very important to know, instead for our competitors, we use only high molecular weight hyaluronic acid, and this weight is more like 1,400 kilodalton, which goes through the three-phase cross-linking technology to form porous microsphere in the first stage. In subsequent stages, 2nd and 3, the microspheres are cross-linked to form first-order granules and then second-order granules. The result is porous structured gel. Actually, this combination and this structure give for us a lot of opportunities, and I come to show you differences. For example, high molecular weight hyaluronic acid and micropolars, which provide anti-inflammatory properties. It's very important for not only for aesthetic medicine, but considering regenerating goals of aesthetic medicine, it's very important now. They provide immunosuppressive properties, give for body effect of like antioxidant to fighting with free radicals, and provide regulation of fibroblast activity. In which kind of this process, I explain you a little bit later. Instead, low molecular weight, what we can to consider now. And when we discuss, dear colleagues, about Novacutan BioPro, like a Matrix Biomodulator, we can think and we can to explain for our patients also mechanism of action. It's 3 action: extracellular, like matrix, intracellular, and subcellular on the level of mitochondria. Very important that each of these action absolutely approved and through laboratory investigation. Once again, colleagues, first level extracellular, second intracellular, and subcellular. Extracellular method provide for us improving skin elasticity. At the same time, I would like to share with you the pictures of fibroblast made in laboratory Fiji, And you can see this very small, but it's have a lot green points. It's on green, it's exactly colored hyaluronic acid. And we can see hyaluronic acid inside of fibroblast. That's why it's absolutely proven action, like on the intracellular level. For what is needed? Because when we think about regenerative activities of our procedure, of our injection, we should to know how it works, how it's combined with fibroblast, because as you know, fibroblasts have main role for creating of collagen in the tissues. And our product, Novacutan BioPro, we can find in the inside of fibroblast, and in fibroblast they stimulate activity of fibroblast. That's why increase synthesis of protein, which are collagen. It's also evident fact, and we can see this green one, like penetration of hyaluronic acid molecules formed during the biodegradation of Novacutan BioPro into cells like fibroblast. Instead of control group, when we can't to see control group, it means when we use another product, not Novacutan. It's completely different pictures. Also, very important for us, mitochondrial level. Actually, this level which provides intracellular activity. And as you know, mitochondria is very important through ATP as energy to the cells. Effect of Novacutan BioPro on APT expression in fibroblast inflammatory models, we can see on this picture, and we can see a result on this yellow one, which we used exactly Novacutan BioPro for expression, for ATP expression in fibroblast in the inflammatory models. Of course, it's very important to understand why Novacutan is much better like another product which are in now market of our product. Dear colleagues, let me also say a few words about so call it like Parkin. It's special mitochondrial protein which regulate and which are directly engagement for the mitochondria quality. Actually, mitochondrial protein forms the preservation of the mitochondrial membrane and prevent mitochondrial aging. And actually, it's proven on the many clinical investigation that Novacutan activate activity of Parkin-like protein. You can see on this blue pillars using BioPro, you can see. For me, as specialist of regenerative medicine, it's very important fact which give for me opportunity to be absolutely insured when I use this product for my patients. And it's explain me, this fact explain me why my patients really very happy after procedure, not only immediately after procedure to looking of changes immediately visible, but also after long time, because they stimulate activity of the skin, they improve activity, they improve conditions of the skin through activity of mitochondrial mechanism in the cells. The same for integral marker of the cell proliferation, like which Ki67. This proliferation is evidented increased using BioPro. And finally, Talking about Novacutan BioPro, we can to consider correction and prevention of age-related changes of the skin, glowing the effect, significant improvement of the skin quality, tissues compartment like slimming effect, lifting through stretching ligaments inside, and also delicate compensation of missing volumes. And in this case, considering using Novacutan BioPro as for correction of volumetric defect, we can be absolutely ensured they, first, these micropores of Novacutan don't to destroy so fast in the soft tissues. They don't to create a lot of edema through special micropores and microporous 3D structure which are created by process. That's why we can to achieve very nice, very native result for long-lasting time. Dear colleagues, now I would like to share with you practical use of a Matrix Biomodulator. And before, I would like to ask, someone use this product? Oh, definitely yes. And maybe someone more? No. Andrea, yeah, I know that you use it. So, and actually, it's very important to know that for Novacutan BioPro created two different kind of installation. It's so call it like D lift and V lift. What is differences? To be very easy to explain at first why we use this product. V lift we use using cannula, and we use cannula 20. You can see on these pictures, 22, 25 gauge. It's linear retrograde like fan. Usually we use this technique to treatment of rosacea as well, to improving of the skin conditions. Course like 3 treatment interval 3-4 weeks, like every month we repeat 3 times, and we can to provide long-lasting result for this. Instead, we use also, and I like also very often use dynamic lifting, Novacutan BioPro, which have in the syringe 2 ml inside. We use needle 30 gauge or 31 gauge. Usually 30 gauge is best. We use only boluses through like micro droplets. Use this boluses subdermally, but also very important, we put these droplets under the ligaments, retaining facial skin, retaining ligament, providing ligament stretching, and at the same time we create lifting, soft and very natural lifting of the tissues. Very important is these methods are proven by ultrasound diagnostic, and you can see in cheekbone area in this picture differences before and after, and on all criteria of ultrasound diagnostic of the skin, we can see real result of improvement. About long-lasting result and long-lasting effect. As you know now, the structure of Novacutan have granules in granules. That's why, and creating microporous structure. And actually this structure is created technologically in the manufacturing process provide long-lasting effect by step-by-step biodegradation. And this biodegradation going very sequentially and long-lasting. That's why we can to consider long-lasting result instead of another product which use, as you can see, a lot of our colleagues use another product. That's why my recommendation to choose correct product. It's true. Now I show you. And the unique three-phase cross-linking technology provide actually this long-lasting effect. It's understanding. 1 second. Dear colleagues, let me to repeat action of product. It's moisturizing of the and radiant skin. It's smooth texture, even complexion, delicate skin frame, soft tissue lifting. As I talked before, straightening of ligaments, and we use this effect and action of Novacutan for lifting of soft tissues of the face at first. Delicate volume restoration, and fillings the fine lines and wrinkles on the face and on the neck as well. That's why indication, it's very easy and very clear. It's dry and dull skin tone, low skin elasticity, skin ptosis, uneven skin texture, uneven skin tone, wrinkles, and unclear facial contours. In my practice, I prefer, but it's only in my practice, I prefer D-lift, like dynamic lifting. I use for many areas like temporal, lateral cheekbone, zygomatic eminence, nasolabial fold, marionette line, marionette labiomental fold, mandibular edge as well. Using only bolus like micro drops, and quantity of this micro drops is starting like 0.1 until 0.3. Maximally, time to time, I can to use 0.35, but not more. For this, I use special point which are responded for location of ligaments and septum under the skin. And injection we provide subcutaneously. Before providing this injection, we lift a little bit soft tissues and put our product, this very small quantity, but they work very effective. We put this small quantity under the ligament, providing straightening of ligament and lifting effect. You can see result of protocols of D-lift. You can see, for this case, you can see straightening of jaw lines through volumization of cheekbone area. You can see lifting of eyebrow and lateral end of eyebrow in this picture. You can see lifting and elimination, a little bit elimination of nasolabial fold using also it's droplet like 0.1 ml, and patients can to see result. And it's very important that our patients, after my procedure, they talk to me, listen, doctor, you use only 2 ml for entire face, but before, like half a year ago, my another doctor, my specialist, put for me like 4 or 6 or 5 ml fillers to achieve the same result. It's true, we can to use minimal quantity of product to achieve best result and long lasting, and at the same time providing treatment of the skin. It's very important because we stimulate, we activate regenerative activity of the cells on the intracellular activity through mitochondrial activity as well. I would like to share with you another case. The same you can see visual result for jawline lifting. We can see improvement of oval, of course, considering minimal quantity of the injectable product, but you can see differences. And very important, these differences we can observe during at least half a year, 8 months, it's true. Instead, we left usually recommendation to use for the improving of the skin, because when we inject by retrograde injection, we spread material on the very wide area, and this method is very effective for treatment of rosacea. It's evident in fact, and a lot of documents, a lot of references you can see on Google. Also, we use for vector lifting, we use the same 2 ml syringe using cannula, like on this video you can see. More detailed, we teach our doctors in our workshops. Of course, we should to put absolutely superficially under the skin, but superficially, to arrange activity of fibroblast. You can see another cases, not only for female but male cases as well. You can see improving of the skin, as you can see on the cheek area, on this, or this is a very visual effect as well. It's work of our colleagues from Portugal. And when we provide ultrasound diagnostic, we can see evident and proven activity for the skin improving, like on these cases before and after. The same product we use for neck rejuvenation, for submental area. Also, we can to use for décolleté area as well, using fan technique, using cannula. Of course, for décolleté area, we use cannula 25 gauge, much thinner. In this case, you can see differences of for the neck also. Considering activity, Novacutan BioPro for subcutaneous, on the subcutaneous level, we use very active for hand rejuvenation and hand restoring, as you can see in this case. Finally, Novacutan BioPro, like Matrix Biomodulator, have zoom filter effect on 3-level mechanism of action, delicate tissue frame like matrix recovering, lifting effect and ligament straightening effect. Also very active for fibroblast therapy, providing long-lasting result. I would like to show you my experience, how I was work with my patients using the same 2 ml. On these patients, she asked mostly for lifting jawlines and creating more elasticity of the skin. At the same time, she was concerned for volume of the cheeks. It was interesting to create more volume in the cheek. That's why in this case I was need to use like a little bit. It looks like hypercorrection, but it's like hypercorrection. It's only visual immediately after procedure, because through the swelling, in any case, because I make procedure and I make intervention on the tissues. The procedure, as you can see, absolutely painless, provided very fast. I put In general, one syringe, it's mean 2 ml totally. As we discussed it before, I use also angular activity and angular area. It looks like that. When we provide procedure, I ask my operator to show right side immediately after procedure and left side before procedure. And you can see differences, immediately visual differences. After procedure, our patients absolutely satisfied because we change, we reshape the face. We create more younger shape of the face, as you can see on these pictures before and after.
I think it's good. It's very nice, and it was painless.
The patients absolutely satisfied, and very important, they can see result very immediately after, without any side effect, without any post-procedural signs, and they asked for future to help here. Dear colleagues, before to say thank you very much for your attention, I would like to inform about activity of our product Novacutan BioPro in the IMCAS China, which will take place in July 11-13. And as we discussed with our colleagues from Moscow office, maybe somebody will be in the China at this time. And company Fiji and Novacutan BioPro invite you to take part on this congress. Actually, in this congress will be represented all our colleagues, and I as understood Andrea will be also there. That's why please support Andrea, and you are invited for IMCAS China, right? Andrea, you agree? So, at the same time, it's much realistically thinking Paris class. It's anatomy and aesthetic treatment class in the France by Novacutan, because Novacutan will be like thinking like exclusive Novacutan thinking class in Paris in November, beginning of November. Of course, you can order, you can ask, you can address to Emil and order this event. Your participation is right, yes? So, dear colleagues, I would like to share with you my contact also. Maybe it's interesting. I will be open to your conversation and to your contact with you. You can scan this QR code and to be linked to my Instagram account. Thank you very much for your attention. I wish you success in your activity. I wish you have patients which will be look at you with with the eyes full of love for you, like this lady. I wish you success and prosperity in you in our very interesting field of medicine, aesthetic medicine and regenerative medicine. Thank you very much.